With that said, we are going to get started. So for those of you that know me and those of you that don't know me, my name is Terry Suresh. I'm a nurse practitioner and founder of Hormonal Health and Wellness Centers. We have a practice in Southlake, Texas and in Rockwall. We're looking to expand into the North Texas, Dallas, Plano area, hopefully next year. And we're just incredibly passionate about what we do. The majority of what we do, our primary foundation is hormone balancing. We see approximately a good 400 to 500 hormone pellet patients per month. So this is pretty much all we do. Myself and the other nurse practitioners and staff that work with me, we're very passionate about this therapy, as you'll see. So the greatest medicine of all, it's one of my favorite slides, is to teach people how not to need it. And that is one thing that I am incredibly passionate about, is teaching people how to be well and be healthy without needing drugs and medications. Drugs and medications are incredible. They've obviously cured many diseases and disease states and infections, but by and large, drugs were invented, if you will, for an urgent state of being. We weren't really meant to be on medications lifelong. And if there are things and ways we can prevent diseases to avoid medications, I'm all over it. This is really what I'm passionate about. So what's the difference between treating and healing? Well, when we treat somebody, the context remains the same. We just treated a symptom or a temporary state. When you heal, the clinical response is actually elicited by this change of context, so it brings about an absolute removal of the cause of condition. It's the difference between treating the root cause and band-aiding symptoms. Now, this is the next point that I'm going to make. Injured tissues heals with nutrients and not drugs. And natural cell membrane receptors for hormones actually evolved over time. They can't adapt to synthetic hormones. Our receptors that take hormone in the body don't adapt. They don't change to adapt to synthetic hormones. So synthetic hormones that we use in life are really just band-aiding symptoms. They're not balancing hormones. But I like to look at hormones and the receptors they work on like a lock and key, with the hormone receptor being the lock and the hormone being the key. If you've ever had one of those keys that kind of fits into a lock, but it doesn't really turn the lock, but it fits in there, that's kind of a synthetic hormone analogy. Natural bioidentical hormones, which is really what I'm going to focus on tonight, actually turn the lock and unlock the door, if you will, and unleash all the beneficial effects of hormones. The human body has receptors for natural hormones. There are no receptors that exist for synthetic hormones, and that includes thyroid. We're going to talk about thyroid later, some things that may or may not surprise you. So drugs that treat symptoms, drugs actually treat symptoms of menopause and andropause. This is kind of, well, you can read the slide, but I think it's true. So why does menopause matter now? 100 years ago, menopause was actually the end of a lifespan. 50 years ago, women lived 20 years after menopause. And now the postmenopausal life has actually increased 30 plus years. So how do we optimize those 30 years? That's what I am all about, is optimizing those 30 plus years. And it's the same for andropause. Now, people call andropause the male menopause, but menopause actually means pause in menses. So men don't really have actual menses, but it's the same thing is happening in their body. Their hormones are declining. The testicles are what primarily produce hormones in males, with the adrenals somewhat, and the ovaries primarily produce all of our hormones in females. So as men age, their testicles do not produce as much testosterone as they once did. So a lot of things happen in a similar fashion. So how do you feel? Well, most patients come in feeling depressed and anxious and angry like this guy, moody, irritable. They can't think, they can't focus. They're not sleeping well at night. They're arguing with their spouses. They are gaining weight. Depression, anxiety, irritability, mood swings, brain fog, can't think, can't focus. Low sex drive for women. Men don't really lose a sex drive so much. When men lose a sex drive, their testosterone is very, very low. But all of these things happen. And unfortunately, what happens is oftentimes we go to our primary care providers and we get treated with what? Well, we get pills, right? We get a prescription for antidepressants and anti-anxiety pills and, sleeping pills, Ambien and Xanax and all of these things. And they're really not fixing the problem. They're band-aiding the symptoms. And my new favorite is adult ADD. So many patients coming in on ADD meds, which is basically prescription speed. And I would just posit to you that testosterone, as you'll find out, is a powerful brain hormone. And most of these patients are just suffering from hormone deficiency because anxiety, depression, nervousness, sleeplessness, all of these symptoms are not Prozac, Xanax, Ambien, or concerted deficiency states. So one of the things that I really want to drill home to the audience tonight is really paying attention to this idea of finding what is wrong, what is the root cause, and not just throwing another pill at a symptom, because then that pill causes side effects that you need another pill for, and so forth and so on. It becomes kind of a mess. Now, this is just kind of funny. Aren't night sweats and hot flashes nature's way of lowering our heating bill? Probably not. It's not supposed to happen. So when we think about hormones in women, we think, and I am going to be talking about men here tonight. There's a lot of good information for men. So if some of you ladies on have a man around, he might want to come listen to this stuff because it's going to pertain to him too. But estrogen is the primary hormone that we think about when we think about hormones for women. It's a very important hormone. It has over 400 functions in the body. Obviously, it controls hot flashes. It helps our bones remain strong. It helps our memory. It actually reduces colon cancer risk. Women with low estrogen have a much higher risk of colon cancer. Collagen in the skin. You notice as we age, our skin starts to get saggy everywhere when we lose estrogen. And it increases our happy hormones, serotonin and dopamine. But what's optimal? A lot of practitioners don't know how to look for what is optimal in estrogen, and that's a special blood test called the FSH. And we want that number low. Symptom relief is what I'm going for. We're not trying to restore estrogen levels back to youthful levels, because when we had primarily a lot of estrogen, high estrogen levels, that's when we were mostly trying to make babies and get the uterus primed and ready for a baby. Well, obviously at a certain stage in life, we don't need that much estrogen anymore. We're not looking at trying to restart periods and menstrual cycles and all of those things. We just want symptom relief and enough to help with the brains and the bones. Now, smoking and stress actually decrease estrogen levels. So people that smoke and that are high stress and thin women need more estrogen because we store estrogen in our fat cells. And so, our marathon runners and our gymnasts, this is why a lot of teenage girls that are big athletes, they stop having periods. You hear these things about gymnasts and swimmers not having periods. Well, that's why, because they're so lean. All right, so the reason I have this slide in here is because after the Women's Health Initiative trial in 2002, one of the things that happened in that trial is that's where hormones got a really bad reputation, and doctors and prescribers stopped prescribing them, women stopped taking them, and they were saying they're really bad for you. But what we found is between 2002 and 2011, there were 92,000 almost excess deaths because we were not giving patients estrogen and testosterone. That is a lot more than died from being on hormones, no matter the type of hormone. So this is a great study that showed, look, women need their hormones. Quit telling women they don't need their hormones. We need them. Even if they are synthetic pills, they're a lot better than nothing. And that's what this study showed. Now, progesterone, a lot of people ask about progesterone. It is an important hormone. It's not as key for some of the symptom relief, but women that have a uterus and are getting estrogen therapy absolutely have to get on progesterone. We check blood levels and we want it at a certain level, but it's a really important hormone, and it's a calming hormone. It's beautiful for sleep. We give it taken at night. It doubles as a free sleeping pill. It's amazing. All right, so we already talked about this. But testosterone is key. Although estrogen is a key hormone, I believe testosterone is the hormone for both men and women. There are literally thousands of receptors for testosterone in the areas of our brain that are responsible for mood and thinking and mental clarity and focus. And so when our testosterone levels are low and they start to decline, usually in our 30s for sure, and sometimes even in our 20s if we've already had children in our 20s, that's when we start having these gradual symptoms. And by the time we get into our 40s and we're depressed and moody and anxious and we can't sleep and we can't focus and we can't remember anything. Do you ever walk out of the grocery store and not know know, which way you went, which way to go for your car. Where'd you park your car? Why did you, have you ever walked into your kitchen or into a room in your house and go, why am I in this room? Those are the little memory things that testosterone plays a key role in. And it provides major symptom relief. But as you're going to see throughout this webinar, it protects the bones, the brain, the breast, which is what I talked about in Good Morning Texas today, the heart, joints, and relationships. Because when we're depressed, moody, anxious, irritable, can't sleep, can't focus, and we're not having sex, who do we take it out on the most? We tend to take it out on our husbands or our significant others or our partners or our children or our family members. That's who suffers besides us. All right, so why is bioidentical testosterone important? Well, for men, number one on the list, because it's number one on the list for men, is improved erectile ability. Might not be number one on our list, but it's on their list, so that's why it's first. Prostate protection, obviously. Heart protection, you're going to see amazing studies that show how protective testosterone is to the heart. Energy, overall sense of well-being. That belly that guys get when they get in their 50s and sometimes in their 40s, that's all testosterone decline, because when testosterone levels fall, cortisol levels go up, and that increases insulin resistance, and that increases belly fat. And their brain, anxiety, irritability, it's an amazing hormone for all of that. Now, for women, it protects our heart. It lowers cholesterol, LDL levels, energy, overall sense of well-being. All of these things are symptoms that are relieved with testosterone. No brain fog. Sex drive is increased. I can't tell you how important the sex drive is, and so many women suffering from a low sex drive, which actually creates suffering in their relationship. Doesn't have to be that way. This really is just looking at women were on estrogen by itself, or estrogen and testosterone versus testosterone alone. And what this study showed is testosterone was superior for relieving energy issues, giving well-being, relieving somatic complaints, which is all those weird, symptoms that we just can't put our finger on, psychological symptoms like depression, anxiety, irritability. The worst was estrogen alone. So anybody on estrogen alone are going to have worse symptoms. Now, their hot flashes may be gone, and their vaginal and bladder issues may be gone, but all of those other complaints are still going to be there because you didn't treat it all. Men with low testosterone, these are important numbers. I think somebody asked a question earlier about numbers, and I think this might come up and answer your question. Men aged 30 to 70 will lose 1 to 10% of total testosterone per year, and that puts them at risk for all of these diseases. And for what is optimal? Now, we're going to talk about optimal right now. Optimal testosterone levels for men are levels above 900. This is a great study. It's actually a compilation of studies that shows for every 100 points, a male testosterone level falls below 900. His risk for all cause of death goes up. Alzheimer's disease, under 900. Prostate cancer. Testosterone is so protective to the prostate, and we have it completely backwards in this country. We're so afraid of testosterone because of prostate cancer. Well, let me just give you some information about that. Testosterone can stimulate an already growing prostate cancer, but it's actually a decline in testosterone that increases prostate cancer risk. Think about it. How many 25-year-old males do you know with prostate cancer? It is a disease of usually diagnosed above age 50. And that is when men are the lowest typically in their testosterone levels. Metabolic syndrome, osteoporosis, men suffer from it too. All-cause mortality under 600. Diabetes. What is the very last thing on this list? Erectile function. So what that says is men typically will not go complain to their doctors about testosterone until it doesn't work. And that is the last thing to go in men. This is very important for your guys to see this slide. Take a picture of it on your computers. Share it with your husbands, your significant others, sons, grandsons, whoever. It's very important for men to have a level up above 900. Why am I stressing this point so much? Because average labs, the expected range in a male is between 200 and 1200. So if a man comes back with his regular primary care provider and he has a testosterone of 300, he's going to be told his levels are normal. What I want you to understand is there is no established normal. That is an expected range. We are looking for optimal, which is above 900. Hopefully that makes sense. So women, we lose 50% of our testosterone production. The inner core of the female ovary makes testosterone, outer core estrogen, progesterone. We lose 50% of our production between ages 20 and 40. And it happens invariably after that second baby. We never bounce back. So what is optimal? Well, optimal is above 80 to 100. So men, although men need to be 800 to 1100, we're about 10% of that. 80 to 100, 150. Most women feel the best around in the upper 100s. My levels run around 200. I love it. Feels great. But all of the low testosterone below 70 gets us at increased risk for all of these diseases. So not just how we feel, but as you're going to see with these studies here shortly, increased risk of disease. So this is what is going to answer the numbers question. So 14 to 80 is the expected range. Above 70 is optimal. 60 to 70, you're probably not going to have a lot of symptoms. You might not have as much of a sex drive as you once did. 50 to 60, you're going to have some energy loss and lower libido. But when you get below 40, that's when everything happens. And when you get below 30, it is terrible. It is terrible, terrible, terrible. And most women that we see in our offices are below 30, non-detectable. There are some things that make this worse. Birth control pills suppress testosterone, free testosterone. Wine drinking increases a hormone called sex hormone binding globulin, which binds up free testosterone. So there's a lot of things that can environmentally cause us to also have a low testosterone. But by and large, it's just age. So what's the best? We need bioidentical hormones that are biologically available and not in depot form, means not in shots. We don't like shots. Absorbed directly. We don't like it taken orally because orally things convert. When they're metabolized through the liver, you're going to end up with some things you may not want. Like when you take oral estrogen, you can end up with a higher levels of what we call the bad estrogen, which is called 16-hydroxyestrone. When you take oral testosterone, you can end up with too much bad estrogen. It's not good. So really want to make sure we get it the right modality, and our goal is to optimize. We're not treating lab slips. We use the labs as a guideline for our patients, but we don't treat paper, we treat people. And that's a really important concept. So let's look at our options. Oh, but first, let's ask our doctors if medical advice from a TV is right for us. It's probably not. I don't even watch TV anymore because I can't stand seeing all the drug commercials. It makes me crazy. All right, so we're going to talk about oral hormone replacement therapy first. This horse is going to get a big old shot of human estrogen, and she's not happy about it. We shouldn't be either, because when we take oral synthetic progestins, we are getting the urine of pregnant mares. Premarin is pregnant mare urine. Prem-Pro is pregnant mare urine with conjugated progesterone. So it's all synthetic. But, we really got afraid of this in 2002 with this Women's Health Initiative trial. And it really ended up being a flawed study because there was a lot of flaws in this study that I don't have time to get to tonight. But what happened is the messaging to patients and practitioners is stop your hormones. They're bad. They're going to kill you. And what we know now is that's not the case. And unfortunately, women have gone without their hormones unnecessarily for years. But there are some unnecessary effects of oral estrogen therapy: breast tenderness, cancer risk, heart disease risk increase, Alzheimer's disease risk increase, weight gain, bleeding, headaches, all of the symptoms you see here. These are all unnecessary side effects of oral estrogen therapy. We don't like those. Why? That's because when you take it orally, it has to go through the liver. First pass metabolism means a first pass through the liver. The liver's going to get it, and then it's going to metabolize into what's left over. You can't individualize the dose. It's kind of a one-size-fits-all approach with orals. There's only a couple of doses for everybody in the world. And most importantly, there's no balance with the other androgens, which means testosterone, basically. Very important. Patches, much better than oral because you're not going through the liver. You're not going through the metabolism through the liver. Do have some problems with adhesion, and you got to change them throughout the week, and you can have some weight gain, but you're not going to have as much water retention. But again, no testosterone included. We're not looking at, most women are just getting estradiol, Vivel dot, maybe a estrogen progesterone combo on the patches. Again, better than nothing, not my favorite. Now creams, It's not my favorite either. I used to utilize creams in our clinics before I learned about pellet therapy. There were some problems with creams. There again, no dosing science. Everybody kind of got the same thing. We had to, you have to put it on every day. You have to travel with it. It can transfer to other people, but most importantly, it doesn't offer the bone, heart, brain protection that bioidentical hormone pellets offer, and we actually can prove this in studies. Now, Testum cream is a synthetic and androgel cream. These are synthetic creams that men are often prescribed. And basically what this slide shows is this was a study that followed 300 men over the course of a year. And it basically just shows creams couldn't get their testosterone levels up above 400, 450. And remember from the previous slide, what is optimal is above 900. So and it stinks and it's very expensive. It's about 90 at minimum bucks a month. It's crazy expensive, so not a great option. Shots are my least favorite form. I had a patient today ask me, can I take shots as a female? My first thought was, why would you want to? But no, they're even worse for women. The side effects in shots for women, oh, it's terrible. Don't ever give yourself testosterone shots. But for men, which very common in men, there's a lot of clinics that are just getting shot happy with testosterone and they don't understand how to balance hormones. There's uneven absorption, roller coaster, significant adverse effects. We see patients weekly in our offices with elevated liver enzymes because of shots, because practitioners are giving shots and they don't understand how to balance hormones. A lot of them are. And a lot of these clinics that just do shots, they're not really understanding how to balance hormones. Increases cholesterol levels, increased prostate cancer risk, higher estrogen levels in men. That's not good. Higher blood clot risk because they're making too many red blood cells, and they can't be aromatized, meaning they can't dissolve out in a safe way is the best way for me to explain that. And when they wear off, guys are so cranky. I hear this time and time and time again, guys will get their shot, they'll feel good by day 3, and by day 5, they're crashed and they're terrible, they're bears to live with, and then they can get a shot again at day 7. So not good. Now, this is an interesting study that looked at testosterone shots, and basically it increases platelets. Shots increase platelets, and platelets are what can get sticky and cause blood clots in the heart and cause heart attacks. So not good. So if you know any guys that are on shots, at least tell them to take a baby aspirin a day. It would make me feel better, and then get off those shots. Pellets are my favorite. They've been around for a long time. They're natural. They're yam or soy derived. I always get questions about, well, what if I'm allergic to soy, or I've heard soy is bad for you? The protein that causes the sensitivities to soy or the issues with soy are removed. They're not part of the molecular structure that forms the hormone, so it's not the same thing. But pellets have the same molecular structure as human hormones, why they work so well. They last 4 to 6 months. There's no roller coaster effect. Most importantly, the dosing is highly individualized. It's dosed on parameters of the patient's age, weight, blood levels, activity levels. Those can be tweaked based on patient response, and it's just much easier to control. They've been around the longest. They've been around since the 30s. It's the most widely studied form of hormone therapy. We were studying them in this country in the 30s and 40s, and then Premarin came on market in the 40s. So by and large, the pill became magical, and these modalities fell by the wayside. But Australia, Europe's primarily what they use in those countries to this day. All right, so now, and I know I'm talking really fast, and I'm just, this is like a fire hose, just spraying information at you, but I got a lot of information to share, and you can go back and listen to it more slowly. But what's happening on the inside? Now, patients are very educated. You all in this audience tonight are very educated these days. Google is awesome. It's a blessing and a curse. I have patients all this time that says, my regular practitioner says there's no evidence around hormone pellets or bioidentical hormones. It's investigational. I'm going to share with you it's not true. It's evidence-based. Oh, a doctor gave me this slide. I thought it was funny. A doctor that thinks out of the box. You can laugh at that. All right, so the first thing I'm going to talk about, and which is what might got you on this webinar tonight, since I talked about breast cancer on Good Morning Texas today, is hormones, HRT, and the breast. And the biggest take home is testosterone is highly protective to the breast. As you're going to see from these slides, are numerous, and I only put a few on here because I would bore you with all the slides I have around testosterone protection to the breast. But before I go and talk about how great testosterone is for the breast, I want to first tell you that not all testosterones are created equal. And this slide on the study on the right that says combined estrogen and testosterone use and risk of breast cancer is an investigation that came about with oral synthetic methyl testosterone, which is in EstroTest and SynTest. And what was showed in that study is oral synthetic methyl testosterone can actually increase breast cancer risk because it can convert to 16-hydroxyestrone in the liver. So I just want to share with you that not all testosterones are created equal. If you're comparing bioidentical patches and creams and pellets, it's not the same as oral or shots or synthetics. So it's not comparing apples to apples. But let's talk about androgens. And everywhere you see androgens, that's a fancy medical word for testosterone, basically, is what we're talking about for this presentation. So there's a lot of data that shows that androgens have apoptotic means cell death, and anti-proliferative means stops it from spreading effects on breast cancer. Not stimulation, very important. Animal models have shown similar results, finding that androgens inhibit breast cancer growth. So study number one, I'm just going to highlight the main ones. Patients that have higher androgens, patients that have polycystic ovary disease have higher levels of testosterone naturally. They do not see an association with increased breast cancer risk. In fact, they see protection from that higher androgen. Same thing with high androgen therapy, very effective in treating patients with advanced breast cancer. Another study, this is a different researcher, clinical and non-human primates, they showed androgens inhibited breast tissue proliferation and breast growth. Additionally, estrogen, particularly in oral form, stimulated sex hormone binding globulin, reduces free testosterone. All of this to say is oral estrogens, no good, and androgens are breast protective. Nurses Health Study, 120,000 nurses that were already on oral synthetic progestins were given testosterone and showed no increase in breast cancer. Very important. This is 120,000 nurses. That's a lot. Estrogen and progesterone, very important, reduces estrogen-induced epithelial cell proliferation. What that means is the breast cancer growth. Very important. This is another great study that looked at hormone replacement therapy after a diagnosis of breast cancer, and it relates it to recurrence of breast cancer, and mortality means death rates, basically. So there were 2,700 women in this study, and the rate of breast cancer recurrence was 17 per 1,000 in women who used HRT and 30 per 1,000 in non-users. So right there, the first part of the study says HRT, hormone replacement therapy in general, is protective for women. Breast cancer mortality rates were 5 per 1,000 and 15 per 1,000 in non-users, so much higher rates. Total mortality were 16 and 30. So we see that HRT, hormone replacement therapy in general, very protective for breasts. This is Dr. Gino Tutera's study, who trained me. I trained with him. He's a pellet guru out of Arizona. Has been pelleting patients and teaching doctors how to pellet patients for 30 plus years. He followed his own patients, about 1,000 patients, for 25 years. 25 years. Every one of these, he does not give women estrogen without testosterone, nor do we. One breast cancer in his first group, and she actually was diagnosed within 2 months, which means typically she already had that breast cancer growing. It just was non-detectable. By the time a breast cancer is detectable, we've usually had it brewing for 7 to 9 years. So really important to know, if you're diagnosed with a breast cancer, it's been cooking for a while. It takes that, some breast cancers, some grow faster, but by and large. This is a comparison of my patient database through 2014 and Dr. Gary Donovitz, a practitioner that I used to work with. And basically what it showed is for my patients, about 3,000 female patients, we had 3 breast cancers. And for his patients, about 9,000 female patients, they had 9 breast cancers. So this is really fantastic, because what we see just normally, breast cancer risk in the average woman are 1 in 7. Very important. So what we can glean from this is how protective testosterone is to the breast. Dr. Donovitz shared he used to diagnose at least 14 a year before he started doing pellet therapy on his patients. So really important. Now, Dr. Becky Glazier is a testosterone pellet implant breast cancer guru, and she's phenomenal, the research that she's done. But basically what this study, this very exciting study showed is that they actually placed a testosterone pellet with an estrogen blocker inside a breast tumor and showed bigger reduction than any other form of breast cancer treatment that we've seen. By week 13, they documented a 12-fold reduction in tumor volume. This is really exciting information. Moreover, added bonus is the women felt good because they got systemic levels of testosterone were achieved. I shared this study today on Good Morning Texas. Really important. I love it because, number one, there's a lot of patients in this study. Over 1,000 patients were in this study. They were breast cancer survivors that they used testosterone with the estrogen blocker, anastrozole. And over 8 years, they followed these women, 1,000 women, and they concluded that with testosterone in combination with anastrozole, they had no repeat breast cancers. Women of every menopausal symptom had relief in every symptom area. It was just incredible. I see this in my practice all the time, but this was exciting study to show how safe and necessary it is for women to have their hormones, and breast cancer survivors can absolutely have their hormones safely. I've had many breast cancer survivors come in and say, well, my oncologist says I can't even get testosterone because of the conversion to estrogen. There is a slight conversion, or can be a slight conversion from testosterone naturally to estrogen. We haven't seen, even in patients without the estrogen blocker, this increased breast cancer risk. But hey, this is added protection. You've got the estrogen blocker in the pellet with it, and it's there for 4 to 6 months. It's awesome. So a lot of positive hope for breast cancer survivors. So I could go on and on about this, but the take home on breast is pellets does not increase the risk of breast cancer. Synthetic methyl testosterone does, and we really want to pay attention to, sorry, I lost that. Treatment with testosterone and estrogen does not increase the risk of breast cancer, even in survivors. So the next thing I'm going to just touch on is how protective the androgens are to the bones. There are receptors found in all 3 bone cells, osteoclast, blast, and osteocytes. Very important that we understand how important testosterone is to build bone. Testosterone and estrogen, they both work to build bone together. Really important. Testosterone build bone over 8% per year with testosterone pellets. That beat patches and orals hands down, as you can see based on the study. Very exciting. We've seen reversals in osteoporosis, osteopenia in our patients over and over again. This is another great study. Actually, this is a compilation of 4 studies that showed pellets gave the best change in bone density increase, over 8%, as you can see. Compared to patches, orals, and then, of course, the control had negative effects. We don't want that. Estrogen, also very important for bone, like we see. Blood pressure, this was kind of an overall study of estrogen to show it didn't affect the blood pressure. It didn't increase clotting risk, which is another fear people have, and we saw a lot of great bone density. Awesome. Now, the normal treatment for osteoporosis, osteopenia is Fosamax, Boniva, and some of those drugs. You get a very expensive shot a week. Lots of side effects with these drugs. I don't personally like them at all. I would not put my mother or any family member on them. Not only do they make people really sick, what we see is it's actually slowing our own resorption and remodeling processing, and it makes bone super hard. So you have bone now, but it's so brittle, it breaks. Our fracture rates have not improved in this country. So bone mineral depletion are actually accelerated if you're using these drugs. And they're FDA approved. Makes me crazy. There are cases of jawbone death, causing the teeth to fall out. It's terrible. Don't like those drugs. How does it affect the brain? Well, Alzheimer's disease is a big problem. Going to be very expensive, very costly, triple by 2050. Lots of trials are underway to prevent Alzheimer's disease, but I believe there could be an answer is already there. Both estrogen and testosterone protect the brain. Women have a higher risk over men of Alzheimer's disease, and women with low estrogen have a very high risk of Alzheimer's disease. And then you add low testosterone on top of it, it goes up even higher. Apoptosis is cell death. So estrogen and testosterone decreases brain cell death. Very important. And beta amyloid deposition is the hallmark of Alzheimer's disease. And we see in these studies that there is a protective role of both estrogen and testosterone on the brain. This is called the Cache County, Utah study. 1,800 patients were followed and they had a 30% reduction in Alzheimer's disease if hormone therapy was started within 5 years of menopause, and especially if used for more than 10 years. So the key take home for Alzheimer's disease, like all of these diseases, is prevention and early treatment. This study showed how improved the symptoms of Parkinson's. Don't see any cures or prevention with Parkinson's, of course, but definitely quality of life improved, no question, for Parkinson's patients. All right, the heart, moving right along. Well, basically what we see based on many, many studies, and I only have a handful of them here, is testosterone protects the heart. It reduces heart disease, it reduces visceral fat, which is the fat that lays down around our organs, reduces total cholesterol, reduces insulin resistance, which is what causes type 2 diabetes. Very important hormone. This was a great study that followed over 3,000 men. 6% died due to heart disease, and men had low testosterone were leading the pack. So men with low testosterone were highest in this heart disease death rate. Another great study followed 11,000 men and showed that testosterone at concentrations, blood levels, were inversely related, meaning higher testosterone levels decreased all-cause mortality, heart disease, and cancer. Low T is not only protective, but predictive of heart disease. What if we could protect our guys, our protectors and our providers, and they can be around with us for longer if we can just get their testosterone levels up naturally? You cannot see the same results from shots in these studies. This is natural testosterone. Another one, great study showing that low sex hormones and high SHGB, sex hormone binding globulin, increase coronary artery and calcium scores. Not good. Lots of 500 men here with chronic heart failure. This is all about balancing estrogen. And the reason I put this study in here is there's so many clinics that are not balancing estrogen. They're putting every guy on an estrogen blocker. It used to be the opposite. When they first started, they wouldn't put anybody on an estrogen blocker. And then all these patients were growing man boobs and having all kinds of issues. Now they put everybody on an estrogen blocker without paying attention to balance. Men need some estrogen. So what this study showed that men that had very low estrogen had a much higher rate of death. Men with high estrogen had a high rate of death, but men that with balanced estrogen, and we know how to balance estrogen, had the fewest deaths. So estrogen, excess estrogen contributes to the development of heart disease, and men with low testosterone and low estrogen had much higher risk of death. I wish the people that run these testosterone shot clinics understood this, that they are not doing their patients any favors. It makes me crazy. I'm sorry. I'm very passionate. All right. So we see testosterone plays a role also in our metabolic disease and type 2 diabetes risk. This is all about blood sugar and how testosterone actually decreases circulating insulin levels, which decreases type 2 diabetes risk. Low testosterone, this is several studies combined associated with excess abdominal fat, loss of insulin sensitivity, and heart disease. That's not a good combination. And women get heart disease. And after menopause, 1 in 3 of us will have heart disease. And it's a silent killer for women because we don't present with the same symptoms as men do with this crushing chest pain. It's very insidious. We may just feel tired or a little bit nauseated, and then boom, heart attack. So really need to pay attention to how hormones protect the heart in women as well. So all of this says right here is basically that heart disease is killing more women than breast cancer. We really need to pay attention. We pay so much attention to breast cancer in women. Nobody's looking at heart disease, and it kills more women than breast cancer. Really important. So we see hormone replacement therapy and cholesterol in women. Estrogen with pellets had effect on body fat in women that had better cholesterol levels. And when they added testosterone, it didn't negate those favorable effects. In fact, women had decreased fat mass after 2 years. It takes us longer to lose that fat mass than guys, which is annoying, but it's just a fact of life. This is a great study that looked at The association between low testosterone levels and high carotid artery atherosclerosis, which is what can cause strokes. So very important protective role in atherosclerosis everywhere. Joint pain relief is one of the top symptoms that patients could say, hey, my joint pain was gone after I got my pellets. What's up with that? Well, there's a couple of reasons. One, estrogen and testosterone play a role in cartilage formation in the joints, but testosterone is also a powerful lubricant. And we see joint lubrication, eye lubrication, vaginal lubrication. It's a great lubricator all over the body. This was a great study that showed estrogen and testosterone playing a protective role. Even in rheumatoid, okay, well, actually, this study is looking at patients that had hormone replacement therapy, had a 40% reduction in revision rates of total knee and total hip surgeries. That's really important. We see it all the time in patients that have orthopedic surgeries. Their orthos say, gosh, you healed so fast. You're up and going so fast. What's going on? I'm on my hormones. All right. Trailing to the end here. I know I've been talking a lot at you, but this is the important part to talk about how supplements play a role. And basically what I want you to take home from this is you've got to have your vitamin D3 levels above 60. Vitamin D levels below 60 hold a 5-fold increased cancer risk and 160% increased risk of heart disease. It's very, very, very important to get those levels up. You can't OD on D. That's the other take home. If we laid out in the sun naked for 20 minutes, if we're lighter skinned, we will get over 20,000 units of vitamin D. All darker skin ethnicities need well, we all need supplementation, but dark skin ethnicities much higher because dark skin blocks vitamin D synthesis from the sun. So if any dark skin ethnicity has got to take vitamin D. 5,000 IUs a day is the minimum adult dose. A lot of people think they're taking 1,000 IUs and they're taking this amazing, great dose. That's actually a neonatal dose. 2,000 IUs is a pediatric dose. Make sure you're getting enough vitamin D3. The other thing is that you need to pay attention to is that, well, this is basically some studies that showed if you had deficiencies in testosterone and vitamin D, your risk of death is higher. So that's what all this mumbo jumbo is, basically. Either one is bad in and of itself, but if you had low on everything, your risk of death went up by 133% of all-cause mortality. That's pretty high. All right, but you need vitamin A, D, and K together. Now, what are these three guys doing in this slide? Well, I'm not sure, but it's a great visual of how A, D, and K work together. So vitamin A and D are at the base. Vitamin D is that guy staring at us smiling. Oh my gosh. Vitamin A is the brother with the head between the legs. We're not sure what he's doing. And K2 is the brother on top. The point is, if any of these let go, they would all fall flat on their face. The take home for this is I'm so happy everybody's taking vitamin D. That's great. But if you don't get vitamin K2 with it, you're just putting calcium everywhere that it doesn't belong. Vitamin K2 is vital to shuttle calcium from the blood and the soft tissue into the bones and teeth or excrete it if it's excess. So this is kind of a big problem right now. So many people are taking all this vitamin D and everything's fortified with calcium. We're becoming hardened. Calcium is the main ingredient that construction workers harden concrete with. So it's no good. It's hardening our bodies. So calcium, I'm not a fan of extra calcium supplementation. Diindolylmethane is another supplement I talked about earlier today on Good Morning Texas. I didn't really actually talk much about it, so I want to be sure to mention it here. But it's a supplement that actually increases free testosterone levels, so it's very protective to the breast and the prostate in men, but it also decreases estrogen, the bad estrogen, if you will. I have a 16-hydroxyestrone and 2-hydroxyestrone. 2 is the good, 16 is the bad. So DIM is a great supplement, hard to find. We have it here, but you can just Google all about DIM, and there's all kinds of great information from this physician that really did a lot of research. So this practitioner is really worried about this guy's cholesterol, but he's not really looking at the patient. And this nurse or wife or whoever it is said, you might want to actually look at the patient. It's kind of a little lead-in joke to talk about type 2 hypothyroidism, which is where your blood levels of thyroid are normal, but you're completely symptomatic from or thyroid deficiency. We see so much of this in our offices. We treat patients. If it walks like a duck, talks like a duck, it's probably a duck. Thyroid labs are not good to treat. You miss so many hypothyroid patients if you're just looking at thyroid labs. So a lot of doctors and practitioners, we were taught to look at certain thyroid labs. But I'm telling you, if you as a patient or you know somebody that has cold hands and cold feet, that is low thyroid, period, until proven otherwise. I have a patient just the other day. She said, I'm finally not wearing socks to bed after 20 years of freezing my husband with my cold feet. That is thyroid deficiency. Her thyroid labs were normal, but we treated her thyroid and she feels amazing. All of these symptoms, our anxiety and depression, fatigue, those are also can be thyroid deficiency symptoms. So that's why we look at it. You can't just look at testosterone. You got to look at thyroid. New thyroid concepts is T3, T3. Not new to us. We've known this for a long time, but finally mainstream medicine is coming around and looking at T3. It's definitely needed for fat loss. It protects against heart arrhythmias and heart disease. I can tell when I don't take my thyroid, I have heart palpitations. A lot of people don't realize this connection. T3 decreases with stress. Hello, who's not stressed? But dieting, these low-cal diets that people are on 500-calorie diets, whack your thyroid. T4, which is what's in synthetic preparations like Synthroid, levothyroxine, it doesn't always convert to adequate T3. So that's why a lot of patients can have good TSH levels. They're on synthetic T4, but they still feel like crap and they still have symptoms of low thyroid. And the practitioners are saying, well, your thyroid labs are normal. So if you have been told your thyroid labs are normal and you're having these kinds of symptoms, please come see me. I promise you, your thyroid is low. All right, iodine, last one I'm going to talk about. It is such an important mineral. I talked a little bit about it today, as much as I could with my 4 minutes on Good Morning Texas. So I'm going to go a little deeper here with it, but you got to have it for proper immune function. It protects the breast, the ovaries, the prostate, the thyroid. When it's low, it increases the risk of all those cancers. It increases good estrogens. And the halides, which is chloride, fluoride, bromide, which is in everything, displace iodine. They don't put iodine in baked goods commercially anymore. They put bromine or bromide in baked goods, which is causing so many problems. So we've got to take iodine. Our soil is incredibly demineralized in this country from iodine. We just aren't getting enough. And you can't just take any old iodine. You can't just go get, monkey blood or iodine pills from your local vitamin store. It has to be a combination of iodide and iodide. We have a special formulation here. It's cheap. It's easy to take. But if you want to get it on Amazon, you can get it in the form of iodoral, Iodoral. But iodine deficiency is huge in this country, and iodine consumption has been decreased since the 70s because of not being put in commercially baked goods. And since the 70s, we went from breast cancer rates of 1 in 23 to 1 in 7. So we definitely know there's a correlation. Prostate and thyroid diseases have increased. Thyroid cancer has increased 182% since 75 and 2005, since we weren't getting as much iodine. Every time we measure it, it's higher. Pregnant women are having less intelligent children. And a lot of people think, oh, well, I eat salt. Okay, iodized salt has no iodine in it. Let me just tell you that right now. And when you open Morton's table salt, after 21 days, it evaporates. It's no good. And I don't know about you guys, but I don't think I've ever eaten a thing of Morton's table salt in 21 days. I hope you're not doing that. And besides that, that is a chemical sodium chloride. It's not the same as sea salt. Please throw away your sodium chloride out of your cabinets and go get Celtic sea salt, Mediterranean sea salt, Himalayan pink sea salt. Those are very beneficial because sea salt has over 90 essential minerals that we need. We really need, iodine being but one of them. If you're allergic to shellfish, it's not the same as you can't be allergic to iodine. Iodine is necessary for life. But there's a protein on shellfish that people commonly confuse. I'm allergic to shellfish, I can't have iodine. It's not the same. The allergen in shellfish is a protein, not the iodine. So you absolutely can take oral iodine. This study just shows that the lower the iodine levels are, the higher the rates of low thyroid. Very, very related. All right, well, the story I want to just tell about this patient is I had an 18-year-old kid brought in by his mother who'd been relieved of her hormone imbalance, and she was convinced he had testosterone deficiency. We tested all of his levels, and his testosterone was actually great. It was over 900. Couldn't believe it because he was very symptomatic, but his iodine and his D were very low. We replaced him with those. In 2 months, when his mother came back to be seen again, she said, that kid, you have changed his life. Excuse me. He's off of his antidepressants and his sleeping pills. He's doing great in school. Sorry. Okay, sorry. I was talking, and I lost my voice. But anyway, just replacing iodine and vitamin D in him was profound. All right, so now that I've lost my voice, key take homes. Hormone imbalance can occur in men and women at any age, and not all therapies are created equal. Hormone therapy done right is evidence-based medicine, and hormone imbalance is not a one-size-fits-all approach. Understanding, guys, that normal labs may not be optimal for health. Vitamin D, iodine, thyroid, testosterone, all of these things are very important. Our patients, people, everybody, we want to live. We don't want to just be alive. So that is what I have, and there are quite a few of you on. So I'm going to actually take questions or just answer questions as they're coming along here. I know that was a ton of information. I really appreciate your presence. Our website where you can contact us if you have additional questions is hormonalhealthandwellness.com. And then I'm going to answer some of these questions here. So, what numbers should your progesterone and testosterone be at to be in normal or ideal range? So for testosterone, like we talked about, those levels we want them to be, most women feel good in the mid hundreds, upper hundreds, but at least above 80, that's our goal. We're really looking for symptom relief in our patients because what we find is, I love wine. I drink wine a couple times a week. Anybody that drinks any kind of alcohol has higher levels of sex hormone binding globulin. So DIM is very important for that, but we also have to run our testosterone levels a little bit higher to get enough into the cell. So my point with that is every patient is different. So that's why I say the range is anywhere between 80 and 150 to 200. For progesterone, there's a lot of there's so many different schools of thought on progesterone, and some practitioners, OB-GYNs, say if you don't have a uterus, you don't need progesterone. I don't agree with that. I've seen too many studies that show progesterone to be protective to the brain and the breast. And then there are other doctors that are very pro-progesterone, like Dr. Neil Rouzier, who's really incredible practitioner out of California. He likes his patients to be around 10 on their blood levels of progesterone. So somewhere between 5 and 10 is good. But, progesterone is a little harder to balance. There's only a couple of doses for women. 45% of people don't absorb progesterone through the skin, so creams are not my favorite. But progesterone is the one hormone that can be taken safely orally. It does not metabolize through the liver like estrogens and testosterone do. So we actually have it compounded for our patients, natural progesterone given orally. And that's what we're going for. And I have heard from another physician that pellets are harder on your organs. There is absolutely zero data to support that, but I am open to new perspectives, and I'm always love it if any provider or patient finds studies for me to share with all of the hundreds of doctors in the pellet network that do them. Pellets have been around the longest and they've been studied the longest, and just don't see any evidence to support that claim. And the next question is, does the breast process plant-based estrogen in the same manner as estrogen HRT? Well, it depends on the way it's taken. So it's not really about the breast processing plant-based estrogen. It's how does estrogen convert in the body. Estrogen from our ovaries converts into, there's a whole steroid pathway that is too much for this conversation, but there's a particular estrogen metabolite called 16-hydroxyestrone, and there's a couple of other estrogen metabolites that are primarily the stimulators of breast tissue. We like to keep the levels of 2-hydroxyestrone up because that's the estrogen metabolite that gives us all the feel good without the side effects. And that's why we like for our female patients that are on estrogen to take DIM. It's a supplement that keeps that 2:16 ratio in favor of the 2-hydroxyestrone. So we do everything in our power to keep the estrogen metabolism ratios in favor of the good estrogen. That's even if you have normal functioning ovaries. My ovaries are still producing estrogen. I take DIM every day because I know my body could convert more over to the 16-hydroxyestrone. So it's more about it's about the form. Oral synthetic prepared formulations obviously can convert to the bad estrogen, if you will, more frequently. We've seen that in studies. Patches, less conversion, less stimulation of breast tissue because they don't have that oral pathway. So even bioidentical oral estrogens can have a higher conversion rate. So it really just depends on the modality and the patient. If you have higher levels of sex hormone binding globulin, which is caused by birth control pills and other medications and drinking, that can also overconvert your estrogen to other levels. So it really is dependent. And the next question is, if you have a history of breast cancer, what or how much of hormones would you recommend? My favorite, or the only one I use in our breast cancer survivors, is testosterone only with the anastrozole or estrogen blocker. If they're less than 5 years out, breast cancer survivor, or if they are, if some women that are 5 years out are still on estrogen blockers, so obviously they would not need the extra estrogen blocker. So it really is individualized. We don't give estrogen, obviously, to our breast cancer survivors, especially if it was an estrogen fed breast cancer. So it kind of really depends on the patient. I can't answer it about if you have a history of breast cancer. We look at the patient, we look at lab levels, we look at what kind of cancer, was it estrogen fed? I mean, I have a breast cancer survivors that are 10 years plus. She has no idea if she was estrogen fed breast cancer. She was diagnosed young. I have other breast cancer survivors that were not estrogen fed breast cancers. It was a progesterone fed breast cancer. So that's a whole nother conversation. So it really is individualized to the patient. That's a great question. Thank you. Is the supplement Serovital similar to HRT? Serovital. I will do some research on that. I've never heard of that supplement. There are a lot of supplements on the market that increase androgens and increase testosterone levels. So I'm not sure about that one, but I will write that down. And you can, email us at contact@Hormonal Health and Wellness, and I'll do some research on that one. Serovital. Okay, not heard of it. I always learn something new out there every time I do these. How to get accurate testosterone level blood test. Yes, we use serum. That is the most accurate snapshot of what's going on. I used to use saliva. What I found is there are no good studies to support saliva tests. I couldn't really ever make heads or tails of saliva testing. And what I found out later from studies is that saliva testing can be altered even if you've been on HRT 2-3 years ago. So not a good accurate. So serum blood tests are the most accurate. It's what we use. Okay. Thank you for that information about who is stating pellets are harder on the organs. That's interesting. Why would an OB-GYN disagree with BHRT and a high ovarian cancer in my family? Since this is plant-based, she does use the Band-Aid method. So usually they blanketly, OB-GYNs will dissuade you from any BHRT if you have any kind of cancer, and mainly they don't want to take liability. But you have to look at the kind of hormones that you're getting in your body. You have to, and the other thing is, what I'm hearing this say is, this OB-GYN would say, you have a family history of ovarian cancer, so you're just going to have to suffer for the rest of your life and not have hormones, even though hormones have shown to be very protective to the brain, the bones, the breast, the heart, the joints. So you're going to die of something else because you're going to have a risk of an ovarian cancer that is actually a very low risk anyway. It doesn't make sense to me. That's throwing the baby out with the bathwater. So I think it's a lack of knowledge, a lack of education on all the different hormones. In defense of primary care and OB-GYNs and practitioners, we only know as much as the drug companies that come to our offices teach us, or what we might learn at medical conferences, which are by and large sponsored by drug companies. So we just don't get a lot of really good information. If you paid attention to a lot of the journals that I quoted in this webinar, they are journals that most of us don't normally get in our mailbox. They're not the typical, peer-reviewed medical journals that are full of pharmaceutical ads in them. These are the real deal. These are European endocrinology journals, neuroendocrinology journals. Why would an OB-GYN get a neuroendocrinology journal or a European Journal of Endocrinology? My point is OB-GYNs get magazines that pertain to gynecology, and not all the hormone data comes from gynecology magazines. So you really got to know where to look for the information. Okay, so this person said, I've recently been diagnosed with a certain cancer. They had testosterone and estrogen on 10-1, surgeries on 10-4, estrogen blocker until the pellets wear out. So what I'm understanding you say is you got pellets before your diagnosis, and would you recommend an estrogen blocker? It's hard for me to answer that question because I don't have all of the information about the cancer diagnosis. The person that asked this question, I would have to have a lot more information than that, but most practitioners are going to tell you, until you get that cancer taken care of, don't get any hormones at all. And obviously, I would concur with that. Get through all of your whatever treatments you're going to do and those kinds of things, and then sit down and look at, was it an estrogen-fed cancer, et cetera, et cetera. But by and large, most breast cancer survivors are going to be on an estrogen blocker for the first 5 years, especially if it's an estrogen-fed breast cancer. So I'm missing some information. I'm sorry to be able to answer that question fully from you. I take a prescription for progesterone. Should I switch to the kind? I love natural compounded progesterone. We have patients that are on commercially prepared Prometrium. It's fine. It works great. I don't like generic Prometrium because it's not as efficacious as the commercially prepared Prometrium. So I wouldn't say switch to another progesterone if it is Prometrium. But I would need more information from you, like, have you had a hysterectomy? There's just a lot of questions. I'm so sorry. It's hard to answer without that information. Yes, and the webinar questions were recorded, and it looks like we are 6 minutes over. So I really thank you all for your time, and be looking for this webinar recording and send it out to your friends and family, and I look forward to seeing you. The last slide I'm going to show are some great resources, books that have some great information about a lot of things I talked about today. So I'll leave this up on the screen and you can take a screenshot of it, and have a great night. if you're still on here, I just two more questions rolled up, so I feel compelled to answer them. In late 60s, have had two heart attacks and a complete hysterectomy in my 20s. How is this going to help me? Let me count the ways. So many life-changing ways that this can help you. Please, please come see me or one of our practitioners. And where do we find the link? We have your email addresses and we will send you the link to the recording of the webinar. Great question. All right, with that, I'm definitely signing off.